Hey, welcome to the clinic. I just wanted to go over our welcome and onboarding handbook so that you have all the information that you need, that you can look through this or you can just listen to me talking about this, this material. And if you have any questions, you can always reach out to me. But this is just kind of going to be your guide on how the clinic works and how to reach me. Okay, so let me just scroll through here. A little welcome letter from me. All right, on the About Us page, you'll find the phone numbers here as well as other email addresses. So please program this into your phone. Put our address in, put our main phone line, members line, um, and our fax number, which we'll also give out. So that way, if you're out somewhere and you need to get records sent to us, or if you were in an urgent care or an emergency room seeing a specialist, they usually have our numbers. Sometimes they do, sometimes they don't. And so make sure that we have the fax numbers there and emails as well. So next is talking about like how to reach us and about communication and when we're open. So we are open by appointment only, and that's Monday through Friday. When you reach out, we get back to you. We're closed on weekends as well as holidays. If you need something routine or non-urgent, which is the vast majority of the time what patients are reaching out for, 95% of the time, something non-urgent, routine, just send us a portal message, and I'll talk about the patient portal and how to sign up and what it's called in a minute. But send us a portal message. It's like an email, and I get back to those within 1 to 2 business days. And things people ask about are follow up from visits, scheduling, medication refills, kind of any of those categories of needs. People can send me emails non-urgently, but I do review those less frequently, and you may have a longer reply. So definitely the portal is the way to go. Now, if it's a more urgent need, or you're like, I'm not sure, do I need to be seen today? I'm kind of worried. I don't feel too sick enough to go to the emergency room, but I'm like not, I'm kind of unwell. Well, if it's the daytime business hours, just call or text our phone number, and I'll review that in between patients or as soon as I get it and get back to you. And we'll try to, get you in or give you a call back and see what's going on. If it's after hours or weekends, you'll call the members line. And if you don't hear back immediately, please leave a detailed voicemail so that I can kind of triage and read what's going on, and just state that it's kind of an urgent need or that you're wanting a call back. I will return your call within 30 minutes. So after hours and weekends, you can send it as a text, but if I don't see it, please go ahead and call and leave a voicemail. I do let people know I do sleep. So if I miss it or I don't hear it, please, call me back. Usually the second time, it'll come through. And now if it's a true emergency and you're like, I need to go to the emergency room, just go to the emergency room. You can call me on the way. You can call me when you get there or text me, give me the heads up and say, hey, I'm in the emergency room, or let me know the next day what happened. But don't wait on that. If it's feeling that emergent. If you're not sure and you want to run it by me and you're trying to decide whether or not to go, certainly you can call. I'll always take your call. Okay, so what are the applications, patient portal, texting, things like that? So our patient portal is called Elation Passport. When you join, you'll get an email that says like you've been invited or you have an invitation to the Passport. Please create an account. Through Elation is also the way we communicate with you. It's how you'll schedule visits in there, how you can view some of your records if I'm sending lab results to you, and the messaging, how people will reach out to me. You will be sent a request to do paperwork before your visit. Please complete those at least 24 hours before your visit so I have time to review them and set up your chart before you come in. Next, we do also have texting or voicemail. You can send that to either of our regular clinic numbers during the day or after hours. And I receive those as a text in my HIPAA compliant texting app called Spruce. Patients are welcome to create an account in Spruce if they want to download the app and use it to securely text me. Just let me know if you want to do that. Most of my patients find it easier to just use general texting. I try not to put too many specifics or details about healthcare needs or management inside of the text. We kind of keep it more for logistics and scheduling. But if you have a clinical question, we can communicate through texting as well. So on your end, it'll look like a normal text, and on my end, it's coming through a secure platform. But again, if you want to get it, you can download it and we can get you set up with an account. Okay, so for clinic visits, we kind of do it all ways. So we can do visits in person, we can do them on the video, we can do them on the phone. When you're scheduling, you'll see options to choose the type of visit that you're looking for. Generally, the ones that are in the clinic can be based on preference, like if you want to just come in, but the other one would be based on need. So if you need some blood work done, or you're having like joint pain and we need to examine that joint, or some new symptoms and we need to do an exam, then it's better to schedule it in person. And certainly I can let you know, like if I think it should be in person. Other things are fine to just be a video or phone call, and you can schedule those through the portal. And that way it can be a little bit more convenient if you're at work or traveling or kind of in between things. Okay, medication refills. So first, if your medications, if it's something I've ordered and it's been at the pharmacy, I generally always put refills on it. So your first call could be just to the pharmacy to refill it and see if you have refills. If you call them and they say you're out of refills and you need a brand new prescription, certainly message me. Try not to wait until the last minute until you're about to run out. It would be great if you can catch that, kind of a week ahead of time, mostly because if it takes me a day to get the orders in, it might take the pharmacy another day to get it filled. It's going to be a couple of days. Or if they don't have the medication in stock and they have to request it, which can happen, especially more these days. So if you notice your pills are getting low, go ahead and call the pharmacy first. No refills, call or message me in the portal, and then I'll get it sent in for you. For lab work and imaging, so we run all of that through insurance for patients who have insurance. If you don't, I do have some low cost discounted accounts, or we can kind of get you what the cash rates would be for that type of work. We do draw the blood work here, and we'll send that out to the lab. And imaging, I work with different imaging centers around the city to get the image, if we need imaging to get that done, like mammograms and x-rays and things like that. There's also just some information here about how prior authorizations work. I try to let you know if we're going through that. That can be where, if it's a new medicine or an imaging order, that your insurance wants us to do some paperwork and back and forth. And if they get denied, we have to do more paperwork. So that process can take anywhere from a few days to a couple of weeks. And we just try to keep you updated while we're working on that stuff. If we're calling in or sending you to see any specialists or therapists, things like that, I have a network of people I like to use, or will go with your preference, or people who are close to where you live. I kind of have people who I know are good, or that my patients have really liked working with, that I like to connect with and have you work with as well. And we can talk about that during visits when it comes up. So procedures that we do in the clinic, we do minor injections, trigger point injections, joint injections, small wound repairs, INDs or drainage for abscess growth. We can do skin tags, small skin biopsies, of course, pelvic and breast exams and IUDs as well. And then I just have listed here some of our partner organizations that we work with for different imaging, testing, supplements, probiotics, things like that we recommend or that our patients like using. I have a little information here about if your medication's a controlled substance. So that includes some of our ADHD as well as weight management medications are controlled substances. So I just have a protocol for how I'm monitoring you for safety while you're taking those medications and while I'm prescribing them, how it works. I have some information here just about how we don't bill insurance, that we are membership based, and that we ask 30 days notice in order to cancel. And we'll probably ask you why, but right now, there's not a long-term contract, and you are welcome to let us know if circumstances have changed and you need to go. I also do have some scholarships available for, if someone falls on a hardship, and that's something we can talk about if that comes up. give some information just about making the most of your membership, making sure we're doing routine health maintenance, at least having your annual, and then just staying connected with me. One of the main ways people do that is being on my newsletter, which I send out at least a couple times a month just to kind of give you updates what's going on in the clinic, what community events we're hosting, talks we might be giving, and just try to give some food for thought or things that I'm thinking about or information that I think is useful for patients. So you can connect with me there. You can certainly follow me on social media. I am on Instagram, and so people will connect or kind of get updates from what's going on there as well. And I think that's pretty much it. I just said those things. Oh, I'll just leave in the last thing that we really value having feedback. The more Google reviews and the fresher the Google reviews, the higher we'll show up in the rankings, and then the more patients we can help. And so if you feel that we've done a good job, we'd love your review. And I have some links in this PDF, but I also have those in the email that I may periodically send out or ask you to do for me, which would be great. If you have friends or family you want to refer, I love to work with families and couples. Again, only adult children and up, so about 17 and up. So if you know people who want to get in, I'll always make space for them. And if you have any criticisms or constructive feedback to give me, something that didn't go well, that's not working for you, I do ask, like, let's set up a time to talk about it, or just reach out to me directly rather than like posting publicly online, and I'll try to see how we can make it right, because that ultimately is our goal. All right, and that's everything. So if you made it this far, thanks for watching. There's again the contact information and everything in the front of the book, and that's probably the most important thing you need in addition to getting signed up for the portal. I can't wait to meet you.